At 2:30, but starting tomorrow, we will be back to our regular time, 1 o'clock every day, 7 days a week. This is the best place to have to get your information, most up-to-date, accurate information on the coronavirus here in the state of Rhode Island. Today, I am very sad to report another 5 deaths in the state of Rhode Island as a result of coronavirus, bringing us to a total of 35 losses. We have 220 new cases for a total of 1,450 cases, and we now have 143 people in the hospital. The number of people in the hospital is what we are very focused on now, and tracking how quickly that number doubles and increases. And 143 people in the hospital, we're at a good clip of increase, which means, again, we are in the rapid spread phase of the virus, and you should assume at this point that there is widespread community transmission. A few quick notes today. I'm trying to respond today on the basis of the questions we're getting most frequently at this point in time. So the first note I have is around testing. A couple of days ago, I announced that in Rhode Island, in partnership with CVS, opened a rapid testing facility in the parking lot of Twin River in Lincoln. This is going very well, and it's a test where you drive through, you're swabbed, you're tested, and you have your results within a half an hour, hopefully less than a half an hour. However, we hear that a lot of people are going into CVS pharmacies requesting a test. You cannot do that. The only way to sign up for a test is to go online to cvs.com. So if you have symptoms of coronavirus and you want to get tested, go to cvs.com and make yourself an appointment. And at the time of your appointment, you have to drive to Twin River, and they have a facility there which we have set up. They're working in collaboration with us, and you'll be tested, and you'll get your results right there while you wait in your car in the parking lot. But please do not go into your local CVS pharmacy, because you will not be able to get tested. These tests, as I say, are rapid. So we want those tests to be reserved for people who are 60 and older, healthcare professionals, people who have to go to work, essential workers, people who need to get a rapid result. And it's only for adults. It's 18 and above. If you are under 18, or if you are young and healthy, but you have symptoms of coronavirus, we need you to call your doctor or call your kid's pediatrician. And if you call your doctor or call the pediatrician, they can then make you an appointment for a test, but they're not going to send you to CVS. They will send you to one of the other numerous sites around the state being operated by the National Guard, where you will be swabbed and you will get the results of your test in 1 to 3 days. Very important. These tests are accurate, most accurate, on people who have symptoms. So we are not encouraging testing of people who don't have symptoms. So if you have symptoms of coronavirus, you can go to cvs.com and make an appointment for that day, or call your doctor, and they will get you an appointment for one of the other testing sites. At this point, we have capacity to do well over 2,000 tests a day. So if you tried in the past to get a test and you couldn't, try again. Our systems are better, and they'll be even better tomorrow than they were today. Final point. For CVS.com, you can only make an appointment for today. That will be changing soon. By this time next week, you'll be able to go on CVS.com on a Monday, and if they're booked up on a Monday, you can make your appointment for a Tuesday or a Wednesday. That functionality isn't up yet. So for today, go on in the morning, cvs.com, make your appointment for that same day. So I hope that clarifies. And again, please do not walk into the CVS pharmacy. it's dangerous. If you have the virus, you'll be spreading the virus. We don't want anyone who's sick to be leaving their house, period, unless you already have an appointment to get a test. Maybe that's the simplest way to remember it. If you're sick in any way, you shouldn't be leaving your house. The only acceptable reason to be leaving your house is if you already have an appointment for a test. You go, you get tested, you don't leave your car, you go back home, and you stay in isolation in your house. A couple of other announcements. This afternoon, the courts extended their closure for all non-essential business through May 17th. I want to thank the courts for taking this step. More generally, I'd like to thank the courts for their cooperation. My office has been in touch with the chief judges of all the courts. You've all been terrific in helping us at every step in making decisions and helping Rhode Islanders through this crisis. So I want to thank you for your cooperation. Importantly, what this means for the people of Rhode Island is that you cannot be evicted at any time for any reason between now and May 17th, because an eviction is a court procedure, and the courts are closed for non-essential services. I will say I hear from people all the time who are struggling to pay the rent, and so I want you to know you won't be evicted because you can't pay the rent. And if anyone tells you otherwise, I want you to call my office, because it isn't true, because the courts are closed and you cannot get evicted. I also know people are struggling to pay their mortgage, and we're working on ways to provide relief around that, and I hope to have an announcement in the next few days or next week to help you get some forgiveness, because I know it's impossible to pay a mortgage if you and your family are out of work. So I want you to know I don't have a good answer to that right now. I hear you. I'm working on it, and very soon I hope to be able to make an announcement around mortgage payments to give everybody some breathing room. We have been getting a lot of questions about food and food delivery. This is an issue for so many people right now. So many kids who are used to getting at least 2 meals a day in school, but schools are closed. Elderly folks, seniors who are used to relying upon senior centers for their 2 or 3 meals a day, and of course people who are in quarantine and isolation. We need you to stay at home if you're in quarantine, but also we need you to be able to eat, and so we're ramping up our food delivery. I want to remind you that we have a new website. It's called ridelivers.com. ridelivers.com. If you're in your house, if you're homebound, if you've been ordered into quarantine, if you're sick and you can't get out, I want you to go to ridelivers.com, and we have a number of ways to get you the food, groceries, or meals, prepared meals that you need. To give you a sense of it, in the last week, more than 40,000 Rhode Islanders have used that website. We're distributing over 25,000 meals a day through Meals on Wheels, senior centers, schools, and other community partnerships. We've distributed nearly 100,000 non-perishable meals to communities all across Rhode Island through our partnership with the Food Bank. Thank you to the Food Bank for all that you're doing. And I especially want to acknowledge Rock's Fresh Food, a fantastic local grocery. We've partnered with them, and they have delivered meals to over 800 families since we launched this partnership just a few days ago. So my top priority is making sure Rhode Islanders are safe and healthy, and of course well-fed. That's the Italian mother in me. We should all always be well-fed. So we're doing everything we can to make sure everybody has the food that they need to get through this. Every day, we're adding more people, more groceries, getting more donations, and we're going to have a greater ability to deliver more food. But if you're hearing me and you're stuck at home and you need a hand, ridelivers.com. If you can't get to a smartphone or a computer, pick up your phone and call 211, 211. It's a United Way hotline. They'll help you get food delivery. And also, you can go on a new service that we've offered, nextdoor.com, nextdoor.com, and it may be that a neighbor or a friend in your community would be willing to bring you food. You can register what your needs are at nextdoor.com. Contact tracing. I'd like to talk for a minute about contact tracing. So when we started 5 weeks ago, we had a very blunt approach. And it's been pretty blunt the whole way, shutting down whole sectors of our economy, asking large groups of people to just stay at home. As our system is evolving, as our knowledge of the disease is evolving, we are trying to move to a place where we get much more pinpointed in our approach. More testing to figure out more quickly and accurately who is positive, and then what we call contact tracing. A lot of people have said to me, you keep talking about contact tracing, what is it? What it is a very detailed process that if you test positive, the Department of Health will get in touch with you and go through a really detailed process of figuring out all the people who you've been in contact with. Because we then need to go tell those people that they've been exposed to you and they are at risk for having coronavirus. So we've been doing this for 5 weeks, mostly manually, and God bless the people at the Department of Health. It's unbelievable what they've done. Amazing, amazing. Mostly manual, many man hours, person hours of work, and they've done a beautiful job. But if I'm going to open this economy, and I am going to as quickly as we can, it has to be more automated and more scalable. So we've been working hard to build a system that is both automated and scalable. And today I'm proud to announce that we in Rhode Island have partnered with a company called Salesforce.com. I'm sure many of you have heard of it, especially in business. Salesforce.com, it's a global software company, and we're partnering with them to make our contact tracing process more efficient, more scalable, more reliable. For you, the average Rhode Islander, you might not see that. You won't notice that. But it should give you great confidence that our systems are getting so much better and we're that much closer to getting you back to work, because this is essential to get everybody back to work. So the same thing will happen. If you get tested positive, you'll be contacted by the Department of Health, and they will go through a system to figure out with whom you've been in contact. Over time, in a week or 2 weeks from now, where I want to drive this is to have the whole system be much more automated. You could imagine a system where you track your symptoms online, maybe on your phone. You set yourself up an appointment on your phone to go get tested. After you're tested, there's this somewhat automated contact tracing system, and then we monitor your quarantine and isolation all through an integrated system. So that's a snapshot of where I want to get. We are not there now. We're working 24/7 to get there, but that's the kind of a system we need to have before we can all start going back to work or thinking about going back to work. You've also heard me every day for the past few days ask you to please keep a contact notebook. Again, I've gotten a lot of questions. Do I really need to do that? What's the point of it? Here's the point of it. I cannot get you back to work unless everybody keeps a contact notebook. It is impossible to keep a mental list of everyone you've been with in a day or a week. So what I need you to do is, at the end of every day or throughout the day, write down on a piece of paper everywhere you've been and everybody you've had physical contact with. When you go get yourself tested, if you have symptoms and if you get a test, you should bring that contact tracing notebook with you to the test. You shouldn't try to go and get a test without it, because it means you're not prepared. So I need everybody to get really serious about this, so that then when you get the phone call from the Department of Health and they say, who were you with yesterday, who were you with a week ago, where were you, what surfaces did you touch, we'll be ready, and we can move more quickly and keep you safer. So I hope that clears up all the questions I was getting about what are you talking about with contact tracing. I do want to take a minute to address the Jewish community in Rhode Island. Tonight is, of course, the first night of Passover. It's a time when families all across the state and all around the world come together to celebrate a very special, very important, very holy holiday. And of course, this year it'll be different. This year it will be different because you have to obey the social distancing order. Social gatherings cannot be more than 5 people. I know that's really tough. This will be different, and I'm asking you to please obey that. And I know it will be difficult. But it is a time for when you get together for your Passover Seder. It's a time that the Jewish people retell and celebrate the story of triumph and freedom over an enemy. And I think that is more appropriate than ever this Passover, as we all together maintain our sense of hope that we will triumph and have freedom against this common enemy. And so I know that you will not be able to celebrate with your families and friends and communities in close proximity in the way that you want to and the way that you should be able to. But I want you to know we're thinking of you, we're deeply sympathetic, and I personally hope that message of hope and triumph over an enemy rings even truer this year for you and your families than ever before. And I will say Chag Sameach to all of our Jewish brothers and sisters, and a happy Passover to all. I especially want to thank Rabbi Sarah Mack and the Rhode Island Board of Rabbis for working with us and giving direction to your congregations. I have to say I've been incredibly inspired by the stories I've heard for all the plans for virtual Seders for tonight and the ways in which you're adapting your customs and traditions to the coronavirus world. Thank you. Thank you for the leaders in the community for working with us, for helping us to enforce these social distancing rules. And as I said, all the best today, tonight, and in the coming days. Of course, I also want to recognize members of other faiths. This is, of course, Holy Week for Christians, Holy Thursday, Good Friday, Holy Saturday, and of course, Easter. Everything will be different this year. Just like Palm Sunday was different, Easter will be different. Churches, unfortunately, will have to remain closed. And I will ask you to do the same and get creative. Continue to worship, continue to pray, continue to find hope in your faith and in your faith communities, but do it in a safe way. I've heard about churches having services broadcast over the radio and people sit in their cars in the parking lot. That's great, as long as everyone stays in the car and keeps the windows closed. But these are the kinds of creative ways that we have to continue to worship, but to do it safely. And of course, in the Muslim community, Ramadan is coming up in only 2 weeks, and I, of course, have more to say about that, but the same thing applies. Start making your plans now, because mosques will not be open, and we will not have an opportunity to have large gatherings and large prayer services as we all would like to do. 2 other things. I've been getting a lot of questions around the order that came down yesterday from the Mayor of Providence, Mayor Lorza. First, I want to thank the Mayor for his leadership. He has shown decisive and swift leadership throughout this crisis in keeping the people of Providence safe, and has been a good partner to me and to the state throughout all of this. He announced yesterday that parks and boulevards would be completely closed. And he did that for good reason. He wants to keep people safe. We have had the chance since yesterday to speak with the mayor and to have the Department of Health speak with the mayor. And so I want to clarify that a bit because we are getting a lot of questions. The policy in Providence will be implemented in a very similar way to the policy we have at the state around parks and beaches, which is to say, if you are lucky enough to live within walking distance of a park or a boulevard, then by all means, go take a walk. Go walk your dog. But the parking lots will be closed, and we don't want you driving there to go for a walk. And above all, we do not want to see crowds or people congregating on the boulevard, on any boulevard, in any park, in Roger Williams Park, in your local community park. In an effort to assist the mayor with enforcement, we will be offering additional resources and help from the state police and DEM as necessary to make sure that we monitor this. So we're going to try this. We're going to try it and see how it goes. If a week from now we have reports, people are in, huge crowds at Roger Williams Park, Blackstone Boulevard is packed and there are groups of 6 or 7 people together, then we will have no other choice than to totally close down the parks and the boulevards. And I really don't want to do that. Everybody deserves exercise and a little fresh air. It's a little sanity to get out of your house. So help us help you. Enjoy a walk, but please do it safely according to these rules. And thank you, Mayor, for working with us. Finally, I'll end on a happy note, an inspiring note, inspiring to me, and I hope inspiring to you. It's crystal clear to me that when the going gets tough, Rhode Islanders come together. And this is about as tough as it gets. The stories that pour into me every day of people can't afford food, their kids are struggling in distance learning, they can't afford to pay the rent, they're sick, God forbid they've lost a loved one to the virus, people in nursing homes. I hear you, and I want you to know we're working every day to address these needs. On the bright side, a lot of people are stepping up to say, what can I do? How can I help? How can I donate? And today I'd like to take a second to call out Mark Perlman at Ocean State Job Lot. Starting today, Job Lot is making free fabric available to anybody so that we can all make our own fabric face coverings. Every job lot has a display set up, and they have enough free fabric for 1 million masks. Obviously, surgical masks and N95 masks need to be reserved for healthcare and truly essential workers and first responders. But for everybody else, every time you leave your house now, we're asking you to wear a cloth mask. Not everybody can have access to that kind of a mask. And so due to the kindness and generosity of Job Lot, everybody can go to Job Lot for free, get the material, and make a mask. And I also know that today they were in Pawtucket giving away food and meals. And I want to thank you, Mark, and thank you to Ocean State Job Lot, a locally owned and grown Rhode Island company, really stepping up when we need it most.